private sector does in delivering healthcare and specifically UHC. And therefore, this is one of many sessions that we've had with the people from both public and private sector, various professional teams. And I'm grateful for KHF planning this meeting. Now, the purpose of what we are going to share today is sometime last year, we undertook an exercise of reviewing the Kenya pharmaceutical policy. And I'm not so sure that I'll be able to share, so I'll ask Susan to just be on standby. If I'm unable to share, then I'm going to request you to share the presentation. Let me see whether that is possible.
Daktari, I'll do that.
Okay,
right
please
away.
go ahead.
Yes.
So as I was saying, sometime last year, we set off on a journey of ensuring that we review the Kenya National Pharmaceutical Policy, a document that was done in 2012 that was to guide the process through which HPTs, specifically medicines, are managed. And it was an exercise, I believe, that was very well done. And the purpose for today's session is for us to be able to share the findings that we found from that exercise. We've already shared this with a lot of persons who are within the sector, and I'm hoping that I will be able to also take this opportunity to share with the more than 300 participants who have already joined on in the call. It will be useful for us moving forward. I think with that, I will go on straight to the presentation. And as outlined there, the objectives of the report dissemination is to lay ground for submission of proposals so that as we start the next process of review, then you can be able to know how well we were able to do in the previous Kenya National Pharmaceutical Policy. So we have 4 objectives for this dissemination, and they are listed there. We first of all want to appraise the participants or the audience on the implementation status of the Kenya National Pharmaceutical Policy. As I said earlier, this was a document, a policy document that was done in 2012. The second part is to engage extensively on the challenges that are facing the subsector, not just for pharmaceuticals, but also all other health products and technologies. We also want to sensitize the audience on the process of public policy making, and thereafter move forward to inviting you to share with us concerns and policy options that will help us in the next step of the policy. We can go on to the next slide. So as I said earlier, we'll be able to take this through various slides. There are going to be about 38 slides that we'll be sharing. We'll be able, first of all, to tell you the process that we went through. We'll also look at the implementation status of the various implementations. We'll mention something very slightly about the key informant interviews and the approach that we went, and also the recommendations that came out of it. So if I may be able to go back to, before we look at the scoring status, the Kenya National Pharmaceutical Policy is also known as a policy. It was actually a cabinet policy. It was also called the Policy Session Paper number 4 of 2012. Therefore, it is something that was approved by the cabinet. It was to guide the sector in the implementation of the various changes that were envisioned in the pharmaceutical sector over a period of approximately 10 years. We set out to find out how well we had been able to do. And specifically, this policy was set up on 12 pillars, which we'll be able to go through. The way we went about the evaluation, we had it in 2 sections. The first section was for us to be able to do a desk review. And basically in the desk review, what we did is to ask ourselves, if today I could be able to study literature, study information that is available through various websites or through various medias, is there any evidence that what the sector sent, what the KNPP set out to do, has it been done? And that was the first stage. The second stage was to go through looking at all the people who were involved in its implementation and come up with what we consider to be key informants. And for those key informants, just find out whether they have any additional information that could help us evaluate the status of implementation. The slide that is before us really tells us how we were able to consider that it's implemented. So for any activity or any criteria that or any intervention that we felt that had been already done, we gave it a full achievement score of 1. Anything in the implementation that was partially achieved, we gave it a score of 0.5, and whatever we did not see any evidence of not being done, we gave it a score of 0. Now, the overall implementation rate that you're going to see in the presentation that I'm going to make was an average of the total scores per pillar. Let's go on to the next slide. So allow me then to go straight to the various pillars. As I told you, there are 12 pillars, and you'll allow us to be a bit faster on this particular one. And the reason is we really we've already shared the document with you, and I would really encourage you to look through the document as a soft copy and be able to look at it. I've also mentioned that there were 12 pillars, which are very many pillars actually for a policy document, but that is the document that we were evaluating. And so I'll start with the first pillar. The first pillar focused on revamping the pharmaceutical sector's governance and policy direction. Now, this pillar had 6 interventions, and when we look at all the interventions, and you'll allow me to speak into some of these interventions so that as we move forward, then we can be able to have an understanding on how it was actually scored. So one of the interventions in this particular pillar, the first one says establishing a Directorate of Pharmaceutical Services or its equivalent. The second intervention talked about reviewing the schemes of service for pharmaceutical personnel to recognize specialization. And the third one on this slide, and I told you there are 6 interventions, so the next slide will be able to give us more. Encourage development of the requisite human resource capacity to address the current emerging pharmaceutical and health sector needs. Now, when we look at the implementation, for example, the first pillar, and I know that we are a bit difficult on this pillar because it was very prescriptive. It talked about establishing a Directorate of Pharmaceutical Services or its equivalent. We know very well that we now have a division of health products and technologies that was established in 2019 and a directorate that was established in 2023 at a relatively high level. And this is something that possibly we need feedback from you. Do we consider that the Directorate of Health Products and Technologies is equivalent to the Directorate of Pharmaceutical Services? And for that, I think in discussion, we felt that it was very, very prescriptive, and we considered that that was not yet done. The schemes of service for pharmaceutical personnel, again, look at the prescriptiveness to recognize specialization. So whereas there's been a review of the schemes of service, the intervention needed to recognize specialization that has not been done. However, if you look at the third intervention, it talked about encouraging the development of human resource capacity to address current and emerging pharmaceutical and health sector needs. So we were able to determine that that is in progress. And just also a rider on how we're evaluating this. It was not based on a gut feeling. It was based on the evidence of each of these items actually having been done. If we move on to the other interventions, the fourth interventions talked about the restructuring of PPB to establish an FDA. Again, a struggle we have because it was an intervention that was very, very prescriptive. It envisioned that PPB would be transitioned into an autonomous food and drug authority within the ministry that is responsible for health, and the link from the Directorate of Medical Services. This was definitely not done, though we know that there's a HPT bill that is in place that hopes to create a unified regulatory authority to address the various challenges. But again, when you have a very, very prescriptive policy, then you feel disadvantaged. I know that in this particular session, we've not gone back to talk about how our public policy is formed, but you'll appreciate that when you have a very, very prescriptive policy, then you get disadvantaged in your ability to determine whether it has been done. The fifth intervention was on the issue of restructuring KEMSA, and we were able to demonstrate that that is in progress. The fourth one was on the issue of the restructuring of the National Quality Control Labs to make it an autonomous body. That has not been done to date, and therefore we scored it at 0. Overall, if we could go back to that, the previous slide, we realized that on the first pillar, the interventions, the 6 interventions had an overall score of 17%. So it feels that the issue of revamping the pharmaceutical sector in the issues of governance and policy direction was not yet well done. The second pillar was on strengthening the pharmaceutical sector regulation. It had 11 interventions, and I'll start being a bit faster in my presentation of the other pillars. The first intervention was all products marketed in Kenya to be duly registered by the FDA. And as I said earlier, again, we realized that our policy was very, very prescriptive. We know that that has been in progress. But if you look at the second intervention on the issue of scheduling medicines for review and regularly updated and enforcing of that scheduling system. Now, scheduling has not been done so far. We've been able to do some work on the guidelines for scheduling HPTs, and there's a vast version that is in place. We know that AU has a model law, but if you look at the ability for us to schedule the medicines, we have actually not been able to do that. The third intervention envisioned that the registered products will require renewal of registration every 5 years based on a defined criteria, and also gave the option of the registration. Now, registration is still done only once. It's not done every 5 years. It's just that annually, the products then are considered to be retained. And it also envisioned that other HPT categories would also go through a registration process, but most of them are currently still only listed, and therefore we scored it as not done. The fourth intervention to the sixth, the fourth talked about premises where medicines are stored and distributed must be licensed. That is work that is in progress. The fifth one talked about personnel who are only registered again by the Pharmacy Council, a body that assumed that it was going to be already in place, that only personnel are registered. And we know that we still have PPB crackdowns on unregistered premises and even unregistered medicine. The next one was pharmaceutical inspectorate function will be consolidated and strengthened under the FDA. Again, something that is very, very prescriptive, and we consider that it's not done because the intervention to consolidate HPT inspection under FDA has not yet been achieved. There was a sub-intervention where only inspectors designated by the FDA would be authorized to inspect pharmaceutical products and premises. There was evidence that there has been some training, but we were not able to very, very clearly demonstrate that only inspectors, again, designated by FDA, a body that had not been formed, were authorized to inspect pharmaceutical products and premises. The seventh intervention was on clinical trials. And this is where we really felt there had been a lot of progress, because the issue of clinical trials and other research activities concerning medicines for human subjects is well guided, and there's a lot of documentation that guides that. The issue of cosmetics and other pharmacologically relevant chemicals and devices that are going to be subjected to regulation, there is already published various editions for requirements for safety and cosmetic products. It's done by KEBS, but PPB had not been able to be advanced to take on the responsibility of regulating cosmetics. And there are no guidelines that had been developed by the time we were doing this. So we considered it to be in progress because some work had happened, and yet we still know that it's not under the envisioned FDA. Now, all pharmaceuticals for vet use, again, this is something that you're going to find is repeated in yet another pillar, but during the period, we actually moved back because we realized that pharmaceuticals for vet use are no longer under regulation by the Pharmacy and Poisons Board. Pillar 10 and 11, we're talking about collaboration with other regulators. That is something that is in place. Issues of conflict of interest, I think that has been very well defined, especially it was talking about the office of the chief pharmacist and the CEO being essentially different, the policy issues being different from the regulatory issues, and that has been done. The separation of function has been achieved. Also, there's a disciplinary mechanism in place, and we scored that as a 1. The third pillar was on expanding availability of essential medicines. There were 10 interventions here, and the previous intervention had been achieved 29%, but for this particular one, the achievement was at 50%. There were several interventions, and there were 10 interventions. The first one was an issue of integration and harmonizing existing public sector parallel procurement activities, and this is something that is in place. And I think there have been quite a lot of achievements in the area of KEMSA that has been given a statutory mandate for procurement, warehousing, and distribution. But we scored it as a 0.5 because of the issue that it also talked about procurement efficiency and procurement effectiveness. We know that we are not there yet, and we just felt that it is something that is in progress. An effective system, let's go back to the second intervention. The second intervention was developing an effective system for procurement of and supply of essential pharmaceuticals. We were able to demonstrate that there's an emergency supply chain framework in place, but there's some work that is still being done, and we scored it as a 0.5. The third intervention under the third pillar was on encouraging specialization in pharmaceutical procurement and logistics through relevant training. We know that there are guidelines that are in place, and also KEMSA has an active method of encouraging training. So we scored it as being in progress. Now, the fourth intervention under there was on the issues of GDP. There are guidelines that are in place. Now, public procurement for vet use, again, was not done because that was removed from the responsibility of both PPB and the process of distribution. Restructuring of KEMSA, we are aware that it has been done, and we scored it a 1. Let's move on to Pillar 7 to 10. Pillar 7 talked about coordinating procurement of essential medicines and supplies in the context of a sector-wide approach through procurement intelligence coordinating committee that is in progress, because we were able to demonstrate that this has been put in place and it has got terms of reference, but it's not specific to procurement only. It discusses all matters HPT. Collaboration between public and non-public procuring entities has not been done. Facilities encouraging and facilitating outsourcing and privatization of the core function of public procurement and supply. We're able to demonstrate that KEMSA has got a framework, for example, for outsourced distribution, and we considered it to be done. The issue of gazetting and zoning regulations to promote equitable access of pharmaceutical product has definitely not been done. So the overall score for that particular pillar was 50%. The fourth pillar was on the issue of expanding local pharmaceutical production. It was production at that time. I think right now we call that manufacturing. There were 6 interventions, and through our assessment, there was an overall implementation of 30%. It envisioned that there would be an enabling environment that has been created to encourage investment in local production and also compliance of good manufacturing practice standards. We know that PPB has really moved ahead, and we are also aware that there has been quite a lot of initiatives, but we consider that both of those are in progress, and we scored it as 0.5. Technology transfer with international accredited local manufacturers to enhance their competitiveness. We scored it 0. We felt that it has not been done because there's no document that is able to show that we are actively engaged in technology transfer. The next 4 pillars were the issues of harmonizing and streamlining relevant statutes to ensure clarity, reduce bureaucratic bottlenecks for local manufacturing. We still have a lot of complaints from the private sector, and we score this as not done. The issue of substandard and counterfeit medicine, we know that there have been a lot of publications that demonstrates that there is, although there is a continued reduction of the counterfeit, substandard, and illegal sale of medicines, and that we scored it as not being in progress. The 5th pillar, we felt, had already been covered in the 5th intervention had been covered in the 3rd pillar, and we did not score it at this level. Incentives for schemes for investment in local production to improve their affordability will also be covered in another pillar, and we did not score it here. The 5th pillar was on improving affordability of essential medicines, and the overall score in the how well it has performed was scored at 47%. The interventions included promoting transparency in the pricing structure. We know that there was a committee that was set in place that was looking at that. Establishing and supporting a multidisciplinary mechanism to monitor and advise on the medicines pricing and affordability is something that is in progress. Providing policy guidance on the pricing structure. Again, all these things are actually done by a committee that was set up 3 years ago that has produced the initial documents. Mechanism for monitoring medicine price increase through notification to the FDA, that has not been done. The other interventions under here were on the issues of expanding and sustaining mechanisms for subsidized essential medicines at primary level. And I think this is something that we've done quite well, and we scored it as a 1. We know that level 1, 2, and 3 have got a mechanism under which HPTs can be available at the primary care level at no cost. Effective exemption mechanisms, that has also been done. We know that under UHC and under issues like in MAMA, and even some counties that have social protection schemes, even the defunct NHIF had social protection schemes, we considered it to have been done. An effective mechanism for reimbursing essential medicines, it's in progress, and we considered the various mechanisms that are already in place through social health insurance. The other 7 pillars were issues on taxes and tariffs for pharmaceutical product. Now, this is something that we are always in discussion, because if you want to score it as a 1 or a 0, it is done, but it is progressive. There are things that were done in 2013, there are things that were done in 2014, 2015, 2021, 2022. A lot has been happening. Is it enough? We can say yes or no, but we considered that that is something that is has been done and continues being done. Encouraging and facilitating bulk procurement of pharmaceuticals. If you look at KEMSA and MEDS, essentially they're pooled procurement facilities, and we still say that because it has not been done at the regional level, we consider that this is something that is in progress. Specific populations are there programs that target specific populations. There was no evidence about that. Issues of generic prescribing, again, we know that KEMSA, KEML, and indeed most of the medicines and therapeutics committees have got their stand on prescribing medicines under generic name. There have also been guidance that have been given by the MAPAC on generic prescribing. The last three interventions in that were on regulations to allow generic substitution. The draft regulations are there, and we are hoping that we can be able to pass them on for input from the public. Affirming the rights of the patients, I think that has been very, very clear, both at PPB, at MOH, and indeed in all public institutions. But it also envisioned that there are some products that may not be substituted, and compliance to quality standards for medicines in the market to allow fast-track registration of generics. There was no evidence that that had been done, and we scored both of those as 0. The next pillar, pillar number 6, was on promoting appropriate medicine use. And this was a bit difficult, but it was also one of the areas that scored best. There were a total of 19 interventions, and I'll be able to go relatively fast. On the issue of the national MTC, it's in place. The role of MTC to collect, evaluate, and disseminate data has not been done. The review of Kenya essential medicines lists, medical supplies lists, and the standard treatment guidelines. Now, it was very prescriptive because it said every 2 years and promote their use at all levels. We had to score it as something being in progress because the essential lists have been updated, but not with the regularity recommended of every 2 years. Promoting essential medicine concept, I think that has largely happened, and we scored it a 1. Let's move on to the next slide. The other interventions were the issues of promoting the essential medicine concept in training programs for health workers. It's in progress. Mandating health facilities to establish MTCs, it's in progress. Encouraging MTCs to adopt the essential medicines lists and the essential medical supplies lists to be procured. That is something that is in progress, and it's working quite well in the counties and in county health facilities. The next interventions, and next slide, please. The other interventions were on the issue of monitoring a therapeutic trend and other medicines that are used in health facilities. There was evidence that there are some counties that do that regularly. Policies and guidelines to improve use of medicines. We do that all the time. And for the first time, we have a national drug formulary that has been developed. Providing feedback to the national MTC, that is something that is in progress. The national MTC actually gets progress on utilization of that. The next few, we're talking about the use of traditional medicine, legislation and control of human, vet, and other therapeutically active substance. There are a lot of guidance from PPB on advertisement and promotion of HPTs, and that has been considered done. Mechanisms for the provision of medicine information. I think there's quite a lot of work that, again, the Pharmacy and Prisons Board has been able to do, but it's something that is in progress. Next slide. The next few were on the issue of a poison information service. We were able to identify that the Kenyatta National Hospital has a poison information center, and the information may not necessarily be available to the public, but is in use among practitioners. Involving consumers in appropriate medicine use. Last week was very important because we had the Antimicrobial Resistance Week, and there were a lot of activities, and we consider that to be in progress. Establishing an effective mechanism for consumer feedback. I think we consider that the Pharmacy and Poisons Board has been able to put in a pharmacovigilance electronic reporting system, and I think it is best demonstrated, especially for the public vaccination programs, because there's a lot of data that comes back on that. A pharmaceutical desk for public complaints, it has not been done. The institutional policy for traditional medicine activities and regulation of traditional medicine products, it's in progress. And that is something that is being done by our directorate. The utilization of traditional medicine in such a way to reduce the risks and maximize, it's part of the things that the policy documents and the legal framework that is under development is doing. And I think we also were able to recognize that a division of traditional and alternative medicine has been established at the Ministry of Health under my directorate, and it is currently being done. Promote the local production and production of useful and commercially viable traditional medicines for human and vet use. There's no evidence that had been done. The seventh pillar was on the issue of pharmaceutical research and development. There were 6 interventions, and this is the only one of the few interventions that fits on a slide. We were able to score the overall implementation at 58%. We felt that the coordination of research that specifically focuses on pharmaceutical services has not been done. A research database, it has been done and it's available at the Ministry of Health. Collaborative mechanisms to promote pharmaceutical research, we're able to demonstrate that KEMRI, the Ministry of Health, and various other institutions have got bilateral MOUs. Support for pharmaceutical research, we were able to demonstrate that the Kenya Medical Research Institute and various academic institutions actually are able to put aside money that focuses on that. For R&D, again, very similar to the fourth one, and we scored it as done, but this specific one, we're able to identify some institutions that are actively doing that. And encouraging and supporting establishment of clinical bioequivalence testing. I think many of us know that that is work that is currently in progress. The next pillar was on the area of ICT, and we had 3 interventions. Just as an observation, I think when you have a very long policy, as you progress in the policy, the number of interventions become less and less. So this one only had 3 interventions. One was on the issue of online sale of medicines. We're able to demonstrate that those guidelines are in place. Implementing strategies to encourage consumers to buy from reputable pharmaceutical outlets. It's in progress, but there was evidence that there are still unlicensed practitioners in the market. Investment in ICT, especially for public pharmaceutical service. There was evidence that there are a lot of initiatives that utilize ICT to improve the delivery of pharmaceutical services. And we scored it as being in progress because some of them are continue being developed. The 9th pillar was on human resource for pharmaceutical sector. Now, again, maybe because it affected the people who are doing this, there were 15 interventions. And this is one of the areas that the interventions had actually been done relatively well. some of the interventions that were envisioned was a national pharmaceutical human resource strategy. And here we realized that whereas it was not specifically pharmaceutical, but there was evidence that healthcare workers have got a broadly established human resource strategy, and we scored it as in progress. I think if you looked at today's paper and yesterday's paper, there is something that we're supposed to give our feedback, public participation on human resource for health. Definitely, the second intervention has not been done. The third intervention was on the schemes of service. We were able to demonstrate that it has been done. And the issue of recruiting and retaining adequate numbers is in progress. So whereas the numbers have gone up, the issue of adequacy has still not been done. But we have the HRH norms and standards, but that has not been fully done. The deployment of pharmaceutical personnel in various capacities has been done. Pharmaceutical training, now this, I think if there was anything, you can be able to score +2. We know that the pharmaceutical training capacity and opportunities in colleges and universities, we have almost a 6-fold increase in the number of facilities that are training pharmaceutical personnel. Mechanisms to enable access by trainees from other countries. I think there are exchange programs that are in place. The scope of postgraduate training, we know that there have been a lot of postgraduate trainings that have been put in place. Mechanisms for progression of diploma to degree, we know that there's been quite a lot of work in that area, and for that we scored that it is in progress. Next slide. We then looked at the issues of CPD. I think that's where we're all in the forum, and we scored it a 1. Multilateral collaboration for mutual recognition. Unfortunately, this has not been done, especially in the region and internationally. The competencies, roles, and responsibilities of pharmaceutical practitioners, their guidelines from the PPB, and also the public sector schemes of service. Regulation of training and practice of pharmacy, there are norms that have been established, and we scored it a 1. Capacity and tools for delivery of basic pharmaceutical services at dispensary and community levels. There are job aids, there are standard treatment guidelines, and there have been a lot of work that has gone at level 1 and level 2, where we know that services may not necessarily be offered by pharmaceutical personnel, but they've been given a lot of information on what they can do. The issue of harmonization and regulation of pharmaceutical training curricula has not been done. That was pillar number 9. On pillar number 10, it talked about the promoting access and safeguarding public health in pharmaceutical trade. Again, this was mainly looking at how have we been able to benefit from the trade-related aspects of intellectual property rights, the TRIPS flexibilities. Where are we? Now, this was, it talked about taking all necessary precautions. Now, that is not smart. And it was very hard to be able to evaluate what taking all necessary precautions is. But we actually were not able to see, in spite of that, any evidence of it, and we scored it as 0. Integrating pharmaceuticals in trade policy decision-making is in progress because we're able to demonstrate that Kenya has been in the process of working with regional bodies and also international bodies to be able to enhance pharmaceutical trade. The Anti-Counterfeit Act to provide for a definition of counterfeit medicines, that was not done specifically to look at counterfeit medicines defined in that act. A national strategy on public health and intellectual property has actually not been done. It was a very prescriptive intervention, but it was not achieved. The issues of joint initiatives to encourage bilateral and multilateral trade fora to uphold TRIPS, there was no evidence that that has been done, although we know that there are ongoing efforts. Participation in regional international activities and initiatives, that is in progress, and there was evidence that we participated in COMESA, in the Africa Free Trade negotiations, in AGOA, and in the Africa Medicines Agency. Participation in relevant state and non-state actors in regional and initiation. This we really felt was not different from some of the other areas that we looked at it, and we chose not to score it at this level because it was scored in other areas. For example, like if you look at number 8, enhance national, regional, and international collaborations effectively to address issues of drug and substance abuse. And the next two, you'll realize that actually they had been done in the various pillars that you've already looked at. So the 11th pillar could not be determined, basically because the 11th pillar was talking about enhancing access to vet medicines. Now, the regulation of vet products had actually been removed. Let's go back to pillar 11. So there were 4 interventions, but the regulation of vet products was actually transferred to the Kenya Vet Board, and therefore it was not possible to score any of this as part of the interventions that were envisioned in the Kenya National Pharmaceutical Policy. It was also not envisioned that these medicines would be removed from the responsibility of the Pharmacy and Poisons Board and put in another board. Therefore, we're not able to score it. The final pillar was on the issue of financing. There were 7 interventions and a relatively good score, 64%. The first intervention talked about mobilizing adequate resources. And one of the things that was easy for us to score is because for the first time we had a national forecasting and quantification document, and also a supply chain strategy that is very well costed. Financing mechanisms, we know that during this time, there are county-specific FIF acts that have been in place and various initiatives that have actually progressed what is happening in this area. The allocation of resources was in progress. It's something that happens every year. The issue of user fees for key essential medicines in the sector is again something that has been ongoing, and we were able to score it as being in progress. I believe the final slide on the pillars was on the issue of mechanisms for ring fencing, allocation of funds for essential medicines and medical supplies. It's in progress. And I think we scored it as in progress because not all counties have been able to assent and implement the FIF acts, which were passed last year. The policy guidance for public medicines budget, we've been able to revise the essential lists that could be able to give guidance on what we consider to be essential medicines. And strengthening financial management, I think we've got various acts that talk about the ability for us to be able to strengthen how resources are used. So those were the 12 pillars. And you'll allow me to very, very briefly talk about the issues of the key informant interviews. What we did for the key informant interviews, we were able to cluster the 12 pillars into 6 thematic areas on access, finance and supplies, regulation, quality assurance and safety, pharmaceutical industry and trade, and local manufacturing, ICT, research and training, legislation, governance, and human resource, and then service delivery and appropriate use. So we targeted a very large number of key informants in each of these categories, and the third column actually demonstrates how many we targeted for each of these thematic areas, and we were able to make sure that at least most of them are interviewed, and they were able then to give us additional information that was not possible for us to access, especially when we were doing the desk review, and we incorporated it into the score of this area. Next slide. So what were the overall recommendations? And you'll allow us to be very brief on the recommendation. First of all, we need, as we're reviewing this policy, we need to address the issue of access to essential HPTs. that could then address both social and economic development. That is one overall recommendation that came out of our situation analysis. The next, it is very hard to implement a policy that is not costed and a policy that does not have an implementation framework, because then you are not able to monitor it as you go along. The other thing is that as we are developing the next policy, we realize how important it is to do a very good stakeholder mapping and also engage the stakeholders. The meeting that we're having today is almost the 10th meeting that we've been having, either physically or through various webinar formats, to be able to see how much we need to engage all the players in who deal with health products and technologies. The definition of HPTs has been expanded from just pharmaceuticals only, and we are really asking ourselves, what will our next policy look like? Will it be a HPT policy, or will it be a pharmaceutical practice policy? And the final one is the issue of allowing us to be able to make sure that whatever policy we put in place is specific, measurable, attainable, realistic, and time-bound. This will allow us to actually develop very clear performance indicators. So though it was a forward-looking policy, it was disadvantaged with the fact that there was no monitoring framework that could allow us to continually monitor and determine how well we are doing and be able to report back to our stakeholders. I believe, next slide, was that the final slide? And so I will open it up for questions and discussions, and Nancy will allow me to give it back to you. Thank you so much.
Thank you very much, Dr. Director Menge, for that presentation. I know there might be a lot of questions from the participants, but I know we have limited time, and our very important goal is to make sure that we are able to give the participants an opportunity to document their policy issues that they feel need to be addressed in the next policy. And that's why we have a very brief session on the submission template, even as we speak to the questions. So I would like to really request participants, if they can put their questions, any questions in the Q&A, we'll be able to answer them directly from the Q&A session. But welcome Dr. Susan to just take us through the policy submission template, so that even most of the issues that you feel need to be addressed better in this next policy can be addressed. I hope that is okay, Dr. Deuri?
Yes, that's fine.
Thank you very much. In the interest of time, Karibu Susan, and please put your Q&A session, and we'll be answering them one by one as we progress. Karibu Susan.
Thank you very much, Nancy. So I'll go straight to the questionnaire. Allow me to share. Give me a minute. And for Nancy to stop sharing. Okay, thank you. So good evening, members, and thank you very much, KHF and PSC for the support. And I'll quickly take the team through the questionnaire. I hope you can hear me.
Yes, we can.
Okay, thank you. Yeah, so we have a questionnaire. It's a very short one. It has 4 sections. The first section is on introduction. Just giving a brief overview of the policy. We have a guide. Again, just describing what are the expectations in terms of how do you identify the problem, and so that it has that public view. Then we have stakeholder detail, where you can either submit as an individual, you can submit as a group, but we encourage stakeholders to submit as a group so that they're able to go through a problem thoroughly and be able also to provide the proposed policy actions. And then we have the key questions. So for you to start providing feedback, you start with an email. So it means even if you work as a group, the person submitting will provide their email address. And then we go to next. So in the next, again, there is no action. It's just reading for introduction about the KNPP. And since this is a Google Doc, you may not be able to attach reference materials. So for the issues, the policy issues that you come up with, if there's any reference, then you can share them to the pharmacyhpt2019@gmail.com. And for any clarification, you can reach out to Nancy through the email, or you can call her and she'll be able to give you more guidance. Then I'll not go through the policy guide. And if you want more details, you can search for the legislative making process guidelines, which is more comprehensive, but will be able to tell you more about how you go about submitting or identifying the issues, packaging them, and submitting them for consideration. So as I said, we are encouraged to submit as a group, and very important to be as comprehensive and clear as possible. So after this is where now you start filling the questionnaire. So you'll fill your name. We just did one last week. That's why you can see it still has my details. Yeah, you can fill here the organization, put it in full so that we know. Like for me, I'll put Africa Resource Center, or put the Ministry of Health, put Kenya Health Federation and such. Then the phone number, your address, and tell us whether you are submitting as an individual or organized or corporate body, organized group, because again, you can come up as together as few members and say, let us discuss the policy issues that we think should be considered, and then you do that as a group. And if there's any other that is not covered here, then you can write what it is. Then the next section is which sector you come from. Are you from academia? Yeah. Are you from private sector, faith-based? Any other that is not covered here, then tell us. So assuming here it is a private sector, now that we are dealing with the private sector, and then you'll go to next. So this is where the questionnaire, the questions start. And for the questions where you have a yes or no, depending on your answer, it will skip to the question that is applicable, so that you don't have to go through all the answer that maybe you don't have a response for. So assuming here you say, so the first question is from the evaluation of the KNPP 2012, the policy was found to be forward-looking, and most of the issues and interventions provided in the policy still relevant today. Based on the evaluation finding, do you think we need to revise, update the policy? So I believe the report, the evaluation report was shared with you, and you'll actually find that this statement is part of the finding. So if you say yes, you'll go to next, and it will take you to question 2. Yeah. Assuming that your response is no, allow me to go back. If your response is no, then it takes you to question 3. You'll not need to answer question 2. But question 2, allow me to go back and say yes. So questions 2 is where you'll make the submissions, because if you say yes, that we need to revise the policy or to update the policy or to make changes to the policy, then we need to ask ourselves what problems or issues or gaps are still existing. And then we describe them, providing details, as we have several questions below that will guide us the details that we provide. So it is, yes?
Go to your screen, please, Risha. We are seeing the lock screen.
Yes, Chege?
So you are not able to hear me. We are not able to see your screen. It's a reshare.
You cannot see the screen?
Yeah.
Okay, let me stop and do it again.
Please share the entire screen.
Oh, I am screen sharing.
Can we see it now?
Perfect. We are seeing number 2. Kindly identify the problems. Yeah.
So do I repeat from the beginning?
This came through, yes.
Okay, fine. Fine. So as I had mentioned, the tool has 4 sections. The first section is on introduction. There's a very brief guide, and in terms of more details, you can be able to download a guideline on legislative making process in Kenya. It's available in the website. And section C is where we start filling. And section C is on the stakeholder details, where we put the person submitting. If it's more than one person, just have your names there. Then the organization for the team that is submitting, the phone number, maybe of one of the members, the address, and then tell us whether you are submitting as an individual, organized or corporate body, organized group, or others, and which sector you come from. Are you from academia? Are you from private sector? Are you a partner, faith-based? So tell us. It's a very short one. That's just details so that if there's any follow-up, then the people reviewing the submissions can be able to follow up. Then for the questionnaire, we have the first question. From the evaluation of KNPP 2012, the policy was found to be forward-looking, and most of the issues and interventions provided in the policy still relevant today. So based on the evaluation finding, do you think we need to revise or update the policy? So if you say yes, it will take you to question 2. If you say no, it will take you to question 3. So it has a skip pattern. It doesn't burden you by going through all the question and maybe you didn't answer. You don't need to answer them. So you are on question 2, and this I was saying that this is the most important question, because if you say yes, then we need to know what policy issues still exist, what problems that we think are not covered, because the people who say no, then they mean that the policy issues that had been identified by 2012 are still relevant today. And you'll find that the question 3 is asking them whether the problem is implementation. Yeah. So for this one, if you still feel that the policy has issues that needs to be included, so we are not repeating what is already in the policy. We are saying that, and maybe the problem that is in the policy today may have changed. Maybe we need to look at things in a different way. Yeah. Maybe we'll even be proposing deletion and such. But are there those policy issues that we need to submit so that they can be considered as we revise the policy? So there are 2 ways of going about this question, about the tool. So if you have more than one problem, you can submit several forms, or you can, it allows you to, if you have five problems, you can say problem 1, problem 2, problem 3, problem 4, up to 5. But when you go to B, C, and the others, you still have to align your responses to if the question 1 is asking what is the problem. So you state the problem, assuming you have 5. So you'll state the 5 of them. And then where does the problem exist? So it means that your number 1 under B needs to align to number 1 under A. If that is too difficult, then submit, for each problem you submit a form. Yeah, so here you'll describe what is the problem and where the problem exists. Maybe it is in academia, maybe it is in the public sector, it is in manufacturing, it is in service delivery, whatever that problem, and maybe it is in half of the county. It could be geographical or it could be in a sector. So tell us where it exists. It could even be in terms of a population. Yeah. No, for population, it is number C, who or what is affected. So you describe there who is affected. Yeah. So again, align. If you have 5 and you've decided you are using one form, describe for us who or what is affected. In D, it is how did the problem come up? So you're giving us a history of, if you have that information, describe, and you can actually see that everything that has a star is a mandatory. So if you don't respond to it, then you'll not be able to submit the questionnaire at the end of the day. So tell us briefly how you think the problem came about. And sorry. And in E, we are asking for the root causes or the causes. What do you think caused the problem? Yeah. Then in F, if you have any solution to propose, because for any problem, maybe there is a way you think, or from your findings, from you reading literature and all that, maybe you have a solution to how the problem should be solved in a brief way, because remember that all these things will be exposed to analysis and stakeholder engagement, so that even the problems, at the end of the day, we have to be clear that these are the problems that exist and these are the solution. And in G, how might the causes be affected by the policy action? So how does the policy action solve the problem? Yeah. So what outcomes or what impact do we expect if that action is to be implemented? And in H, we already know that maybe some of us have already looked at our regulations, the Act of Parliament, the guidelines that exist. And here we are talking about enforceable guidelines, which are guidelines that you actually go through the legislative process, not just the other normal guidelines. So do we think that whatever we have provided, it exists in any of them? And is there any conflict, or they agree? If you have that information, also provide it to us. If you are not aware of any, then you say you are not aware of any. So we go to, so you can see now for this one, it skips question 3, and now we are in question 4. So we'll come back so that we see what is in question 3. So on implementation of the policy, explain how the government, the professional associations, and any other relevant stakeholder would take a tangible contribution to address the issues. So you, depending on your sector, depending on your organization, what is your contribution to the implementation of the policy? Please explain to us. And then question 5, can PP assume that the policy issues and interventions included were applicable to other categories of health products and technologies, that is nutrition, lab diagnosis, and medical devices? Again, we are encouraged to read the policy and also the evaluation report, so that you can be able to align some of these things. And so if you say yes, and you go to next, it will tell it you'll be ready for submission. If you say no, then it takes you to another question, B. If not, do we expand the policy. Remember, this was more of pharmaceuticals, but he assumed that the policy that had been identified also applied to other health products and technologies. So do we then need to expand? That is section 1, or we need to have a different policy for other product categories. So if you say, do we need to expand, and you say no, then it means the next answer is yes. If you say yes here, then the next question you still say, you'll actually say, no, we don't need a different policy. We need one consolidated policy for all health products and technologies. If you say maybe, then it takes you to submission because you are not sure whether it is a yes or no. Allow me to, so after that, you are through with the questionnaire, but allow me to take you back to question 3 so that we see what it is all about. And question 3 will only come if you respond to no here. So I do next. And for this one is asking you, if no revisions, updating of KNPP is required, are there implementation challenges that you would like to highlight? So for the 10 or 11 years of KNPP, have we experienced any implementation challenges? And therefore, it means that you believe that the policy is still valid and the problem is implementation. So then describe here the implementation issues that are there, and if possible, also recommend on what should be done. So if you do next, then it takes you now to question 4 and the rest of the question. So the questionnaire is that short, and you can see if you say yes, then where you have a lot of work is in question 2. Thank you very much.
Okay. Thank you very much, Susan, for that. KHF members, we are very glad that you've given us this opportunity to present this to you. We come to you with a request that you may give us these policy issues for purposes of us beginning the looking at the KNPP, either updating it as is or a new totally different policy, and we need your views as stakeholders to be able to advance from this level of the evaluation report. So I think with that, we've been able to see one question and we've been able to give an input. It was more of a comment. Thank you very much for that. So with that, Dr. Deuri, I'll bring it back to you. And also request if you can be able to tell us when we can get your submissions as members of KHF. Perhaps the aspects of the timelines would be the biggest request for us this evening. Back to you, Dr. Tim Deuri.
Sorry, I was on mute. So I will talk about maybe the timelines. I will allow Lillian to talk about the timelines. My request will be that in the interim, how do we access the policy? Is it accessible on the website? The document that is online right now on the screen, how do we pass it around? Because I think I would want to pass it beyond even the KHF members so that you can get a robust feedback as we possibly can. And then Lillian will facilitate with the feedback process. So how much time do you want to give us for that, for the feedback process? 2 weeks?
Yeah, 2 weeks would be very good. And allow me first to say that we shared the policy itself and the evaluation report, and also the link to this template. All of them have been shared, and I've seen also Lillian Nadiri has just shared it in the chat. So I think that's when you have them. For us, 2 weeks will be very, very good for us if you're able to do within the 2 weeks, and they would love to hear from yourselves. How much, if that is sufficient enough, or do we give you 3 weeks? We just want very good submissions that can pass the test of time when you go to put them as policy actions. Remember, they will go through a lot. Even when you submit to cabinet, they need to be very well supported by evidence. So they need to be well researched and very tangible solutions provided. So if 2 weeks is good, we really appreciate that, because we are in the end of stakeholder engagement on the evaluation report.
Fair enough. I will rely on Lillian to guide us on that. She will advise what she feels is adequate, and I will support her on this particular matter so that we can be responsive best we can. Lillian, will you take the 2 or the 3 weeks?
I think we can take with within 2 weeks and see the feedback that would have come in by then. If it will not be sufficient, then we can extend to 3 weeks. But as of now, I think 2 weeks might be sufficient.
Thank you
Fair
very
enough.
much.
So
Yeah.
we will do that and push it to our members so that we can get the feedback.
Asante sana.
Thank you for doing this with us. Dr. Menge, thank you for the presentation. Very well mastered. And to our Chief of Party, Sylvia, from Population Services Kenya, asante sana. And from the entire KHF leadership, from the board, Dr. Gakombe, and my team here, asanteni sana. I don't think we have anything else. Permission to wind us up?
Yes.
Fantastic. So members, asanteni sana, and to all those who've joined from various places. I've seen someone from even South Sudan. So thank you everyone for joining in. At KHF, we remain committed to support especially the directorate, given that it is one of the only directorates that is really industry facing, and their work is largely in the field. So we will support in this for us to extract a policy document that will be useful for us over the next few years. Thank you so much. Do have yourselves a good evening. We will have this presentation up on our website. Martin will facilitate that, and watch out on our other platforms for the documents as have been advised. Asanteni.